Hello everyone, my name is Bea Tran, and today we're going to be exploring the prevention of spina bifida, a serious neurotube defect, and the pivotal role of folic acid. We'll also discuss the contributions of Dr. Godfrey Oakley in public health policy and practice with relation to spina bifida. So what is spina bifida? Spina bifida is a serious birth defect that occurs when the spine and spinal cord do not form properly during early fetal development. It is one of the most common types of neurotube defects and can result in physical and cognitive disabilities, including paralysis and learning challenges. And what is folic acid and its role? So folic acid is a synthetic form of folate, which is a B vitamin that helps the body make new cells and is essential for DNA synthesis, repair, and cell division. Most critically, folic acid plays a major role in early pregnancy as it helps close the neurotube within the first few weeks, which often this time period the woman doesn't even know that she's pregnant. So a daily intake of 400 micrograms before and during early pregnancy can significantly reduce the risk of spina bifida and other neuro tube defects. So who is Godfrey Oakley? So Dr. Godfrey Oakley is an American epidemiologist and a leading figure in the fight to prevent birth defects. He is often referred to as the father of folic acid fortification and has been instrumental in advocating for folic acid's role in preventing spina bifida. His research and policy efforts led to the U.S. implementing folic acid fortification in 1998, which resulted in a substantial decline in spina bifida cases. So I'm going to be explaining the current situation on spina bifida right now. So spina bifida has some serious birth defects that occur within the neurotube when the brain and spinal cord fail to close properly during early development. On a worldwide measure, approximately 300,000 cases of neurotube defects have been reported each year, with the highest incidence occurring in regions where preventative health measures such as folic acid supplementation are limited. Folic acid is a critical nutrient for preventing these neurotube defects, and while fortification and supplementation efforts have been implemented in some areas, they only prevent about 15% of global neurotube defect cases. This number is so low because in many parts of the world, particularly in low and middle income countries, folic acid supplementation programs are not mandatory or effectively enforced. Furthermore, these limited awareness on the benefits of folic acid combined with inadequate access to supplements contributes to ongoing prevalence of these neurotube defects. But in the United States, a landmark policy that was implemented in 1998 when the FDA mandated the fortification of certain foods such as cereals and pastas with folic acid. And this policy decision dramatically increased the availability of folic acid and resulted in a significant reduction of spina bifida and other neurotube defects. It is estimated that 600 to 700 fewer cases of spina bifida were reported annually in the US due to this mandatory fortification program. However, many countries still lack these mandatory fortification policies, particularly in low and middle income regions. Public awareness remains low and access to folic acid supplements or fortified foods is limited, especially in rural or marginalized populations, which I'll go further in depth in the later slides. Look at the key issues that need to be prioritized in the global fight against spina bifida. The first issue is access to folic acid. In many parts of the world, particularly in these low-resource countries, women of childbearing ages do not have access to folic acid supplements or fortified foods that significantly contribute to high rates of neurotube defects such as spina bifida. The second issue is public awareness. So while these mandatory fortification in countries like the US have been successful, the general public's understanding of the importance of folic acid and its role during pregnancy remain limited in many regions. So educational campaigns are necessary to ensure that women understand the role of folic acid in preventing these birth defects during early pregnancy. Finally, there's the challenge of policy implementation. Many of these countries either lack or have not fully implemented mandatory folic acid fortification programs, but advocacy for these policies are essential to ensure that no country is left behind in the effort to reduce neurotube defects globally. Next, let's examine 3 potential strategies to address the issue of spina bifida prevention and how they compare in terms of effectiveness, challenges, and feasibility. So, solution 1, mandatory fortification of staple foods. The first strategy is, so this option has been proven highly effective in the US, where fortification has been mandatory and has led to the significant reduction in spina bifida cases. The broad reach of this strategy means that it doesn't rely on individual action, making it accessible to all women of childbearing age, even those who may not seek supplements. However, the challenge lies in overcoming regulatory hurdles and the cost of implementation in low resource countries. Solution 2, public health campaigns for folic acid awareness. These campaigns could use media and community outreach to educate women of childbearing ages on the benefits of folic acid. But while this approach can be empowering and cost-effective, it relies heavily on sustained effort and may not reach all demographics, particularly in underserved or rural areas. A third solution is the distribution of folic acid supplements in high-risk areas, such as communities with high poverty rates or limited access to fortified foods. This approach can have an immediate impact and target those most at risk. However, logistical challenges such as the distribution costs and ensuring consistent adherence may hinder its long-term effectiveness. Now let's look at the recommendations that would effectively address the issues we've identified. So the primary recommendation is to implement mandatory folic acid fortification in staple foods globally, because this approach has been proven in reducing neurotube defects in countries like the US, like I've previously stated, and it ensures that the most vulnerable populations like women have access to folic acid even without actively seeking it. But some supporting actions can be launching educational campaigns that specifically target women of childbearing age. Second, establishing supplement distribution programs in high-risk areas where access to fortified foods or supplements is limited. And third, monitoring and evaluating the impact of these interventions, as regular monitoring and evaluation is crucial in assessing the effectiveness of both the fortification program and the public health campaigns, and adjustments could be made based on feedback and results. Next, we'll explore the action plan necessary to implement these recommendations. So short term, the first phase involves advocating for policy changes in countries that currently do not have folic acid fortification programs. This would involve working with policymakers, public health leaders, and community organizations to emphasize the importance of fortification in preventing spina bifida. A medium-term plan that would take 3 to 5 years would involve implementing fortification programs in countries that have passed the necessary legislation for this policy and would include working with food manufacturers to incorporate folic acid into commonly consumed staple foods. And alongside this, healthcare providers must also be trained to counsel women about the importance of folic acid, how to access it, and the benefits of taking folic acid before and during early pregnancy. And lastly, a long-term plan that would take 5 or more years would include evaluating the effectiveness of fortification programs and educational campaigns, and would involve collecting data on the rates of spina bifida and other neural tube defects and adjusting strategies based on what the data reveals. And if certain regions or demographics are not benefiting from this program, targeted strategies will need to be developed in order to reach them more effectively. So in summary, folic acid fortification is a proven cost-effective strategy to prevent spina bifida, and Dr. Godfrey Oakley's leadership exemplifies the impact of public health advocacy in the need for folic acid